Have you ever wondered if you are at high risk for breast cancer? Well, here at Roswell, you'll be happy to know they have a high-risk breast cancer program. And Dr. Jessica Young, my guest, she's the director, she's a breast surgeon, and she has some really important information about that treatment here. So good morning, nice to see you.
Good morning, thanks for having me.
Doctor, how might someone be at high risk? What would let you know that they are at high risk?
Well, I think, firstly, mostly family history is what puts you at high risk, but that's not the only thing that does. There are a lot of other factors that can be personal to you that have nothing to do with your family history. But family history, if you have a lot of people with breast cancer in your family, or even if you see things like ovarian and prostate cancer, we worry a little bit that you might be at higher risk for breast cancer. If you've ever had radiation to your chest wall, if you've ever had breast biopsies, there are a lot of different smaller personal factors that also play into it.
You might not be told that until you actually come in for a mammography.
That's true, and we're really grateful that a lot of mammogram screening programs do try to screen people for high risk and give you an idea, so that can help give you an idea of that as well. But you can also personally look into that yourself.
Well, we have this wonderful program that's here just for patients who are at high risk. So what steps or procedures then would a patient go through in this program?
So really, if you're interested in finding out if you're at high risk, you can call into our program and see if you qualify. But once you come here, a lot of it is just about education and seeing what your risk level is. Maybe you find out that your risk level is actually not that high, which is kind of a reassuring thing to find out. Or maybe you find out that you are at higher risk for certain reasons, or what level it might actually be. I think a lot of people, when they see that their family has a lot of breast cancer, they think it will definitely happen to me, and that's not necessarily true. And so we can kind of give you an idea and then give you different ways to help decrease your risk, or maybe to find things sooner if we can. So there are a lot of different things, but it's mostly about education when you come in.
Plus, I love the fact that you're going to be followed, because I understand there is definitely a connection between breast cancer and ovarian cancer.
So there is a connection. So most ovarian cancer doesn't have to do with breast cancer risk, but when we see ovarian cancer, just because it's more rare, we worry about having like a gene mutation, or the really well-known ones are the ones like BRCA1 and BRCA2, or some people call them BRCA.
Right.
So when we see ovarian cancer, we worry about BRCA risk, and then if you have a BRCA gene mutation, that definitely puts you at higher risk for breast cancer. So there is a definite connection there.
Would a patient be told, okay, from looking at your history, you're going to qualify for this program? Is that how it works when they come on in and are seen? We have a screening tool that helps us to decide whether you're really at risk or not. So some people just have no real risk factors but are just worried about it. But most people have a little bit of family history or some other risk factor. And so once they come into the program, we can talk about your risk and then talk about how often you should be seen, or whether you just need to have your annual screening mammograms and everything. And we have a program for annual screening mammogram here too. And just look at all the tools that you have. You have the 3D mammography. You're in very good hands if you come in and you enter this program.
Oh, I mean, there's so many imaging tools these days, and they're coming out with more and more, but certainly we have the regular mammograms, ultrasound, 3D mammography, which is also called tomosynthesis. A lot of people don't know that. And then also, of course, MRIs for breast as well. So we definitely use all those tools in different ways to help screen you properly.
Roswell Park is doing everything they can to keep you healthy. If you feel you're ready for a mammography, you haven't had one in a year, maybe you've had one, but you're starting to feel something different in your breast, come on in, make that appointment, and have it done right here.
It's so easy to do. We're happy to see anyone at any time. A lot of it is just about making sure that there's nothing there, and we're happy when we can tell you that there's nothing to be concerned about. So I feel like people shouldn't be worried about calling in. Just call us. It's not a big deal, and we'll take care of you.
And that is the very best news to get. You're fine.
Yes, a boring visit is always a good thing.
Absolutely. Dr. Jessica Young, thank you so much.
You're welcome.
She is the director and the surgeon here at Roswell. If you would like more information about this high-risk breast program, all you have to do is call them at 1-800-ROSWELL or log on to roswellpark.org/high-risk-breast.